Good afternoon, everyone. My name is Judy Blake, and I am the Leadership and Advocacy Coordinator for Family to Family Network here in Houston, Texas. I was telling my amazing colleague, Christina,
Hello.
there's Christina, that you would have thought we were handing out the winning lottery numbers today. We had 240 people sign up for this webinar. So clearly, there is a lot of interest in the HHSC webinars. Yes, this will be recorded. And if you don't get the recording by Friday or even tomorrow, please email me so I can send it to you. I'm trying to check off everyone who has registered to make sure that they get the recording. The trouble is that if you're an iPhone or you just list a phone number, somebody messaged me, they don't know how to type in their name when they're on the phone, please email me and I will send you the recording. We will also be sending the slide deck. So you will get both of those. So not to worry. So we only have a Zoom capability for 100 people and we had 240 registered. So if you're on this call, you did win the lottery. You're here. Lucky you. So we're very happy to have Erica Nunn and her team joining us today. Some of you had emailed, you didn't even know what an HHSC waiver was, and your loved one has a disability. Some of you said, yes, I'm on the list, but I really don't know what they are. So we are very, very happy to be having Erica Nunn and her team. Like I said, if you're just joining us, we will be recording it. We will be sending out the slide deck. If you have not gotten it by Friday, please check your spam or your junk mail. Maybe it's there, or you can email me and I will send it to you. No worries. We're happy that you joined us. We are going to hold all questions until the end. Please know that there is no question that is silly or stupid. All questions are important. And it's important that your questions be answered. If you don't feel comfortable typing your question in the chat box, you can private message myself or Christina Zavala, and we will go ahead and ask it on your behalf. Thank you so much. And Erica, go right ahead. I believe we are probably about at our max if we're not already.
Hi, good afternoon, everyone. My name is Erica, and I'm the lead policy specialist, well, one of the lead policy specialists in the Long-Term Services and Supports Policy Unit with HHSC. I have with me today my colleagues, two of the subject matter experts for the waivers for Mdcp, which is Tracy Williamson, and we also have for HCS and Texas Home Living, Olu I knew I was going to mess up on her name, here as well to answer questions and to help do the presentation. I'll go ahead and share my screen so that we can start. Oh, let's see, here we go. And just get in the right mode. Let's see. Okay, everyone see okay? I don't have notes. Okay.
Yes, you're good. Thank you.
Awesome. So today we'll be going over basically an overview of the Texas Medicaid waivers that are within the Long-Term Service and Supports Policy Unit. So the waivers that we oversee. We'll be providing information about the program authority and the administration of how we can provide these waivers, an overview of what the Texas Long-Term Services supports are, as far as service delivery, how you're able to get it, who's eligible to get it, and what type of services are provided in each of those waivers. So what is Medicaid? Medicaid's a jointly through state and federal program that provides medical coverage to eligible needy persons. There are both federal laws and regulations that require coverage of certain populations and services, and they also provide flexibility for states to cover additional populations and services. Medicaid is an entitled program. And so when we say an entitlement program, that means they have to have guaranteed coverage for eligible services to eligible people. And there's also open-ended funding based on the actual cost to provide those services to those eligible persons. So both federal and state governments have a role in overseeing and funding the Medicaid programs. At the federal level, Medicaid is administered by the Centers for Medicare and Medicaid Services within the U.S. Department of Health and Human Services. The authority comes from the Social Security Act that was passed, and that provides general welfare benefits for certain populations. We also have what we call the state plan, which is the contract between CMS and the state of Texas that provides the Medicaid program. And then we have waivers, which is what we'll be talking about today. And they basically waive off, as we say, state plan requirements or Medicaid requirements and SSA requirements. So what is a waiver? Waivers provide states with options to operate their Medicaid programs. Federal laws allow states to apply for CMS for permissions to deviate from certain Medicaid program requirements, waiver applications. So if a state wants to get a waiver to do a certain population, they can seek it through CMS. They usually will seek a waiver to provide a different kind of service or provide Medicaid to a new group, specialty, a specific group types, such as like Dbmd, which is for deafblind with multiple disabilities, or test out new service delivery and management models. A waiver also enables states to receive federal Medicaid matching funds without having to comply with the requirements that are in the Social Security rules. And it just sort of adds freedom of choice of what the state is able to offer. So these are the waivers that we'll be going over today, the 1915C waivers that are in the long-term services and supports. Medicaid home and community-based services waiver program permits states to furnish an array of HCBS that assist Medicaid beneficiaries to live in the community and avoid institutionalization. States design waiver programs to address the needs of these target populations. These services that are provided in the waiver would need to complement or supplement services that these individuals already receive through the Medicaid state plan and or other federal, state, and local public programs. So rather than take the place of, it should be adding to the services they already receive. The waiver 1950C waiver programs that we have are community living assistance and support services, which is CLASS, deaf, blind, and multiple disabilities, or you're here Dbmd, the home and community-based services, which is HCS, Mdcp, which is medically dependent children program. And then we also have the Texas Home Living, TXHML. And we just put a note that Mdcp is the only waiver that's actually delivered through managed care. The rest of these are fee-for-service programs, but Mdcp is provided through Star Kids and Star Health plans to members that are eligible. So as I mentioned, all the 1915C waiver programs are delivered via fee-for-service model. So for those who don't know what that is, a fee-for-service is basically, well, let's see, you can have Medicaid benefits on a fee-for-service basis or through managed care plans or both, which is in Texas. Under fee-for-service model, the state pays providers directly for each of the covered services received by a Medicaid beneficiary. Under managed care, the state pays a fee to a managed care plan for each enrolled person in that plan. And in turn, that plan pays providers for all of the Medicaid services a beneficiary might receive. To enroll in HCS, Texas Home Living Class, Dbmd or MDC, individual has to have their name added to the waiver program's interest list that they would like to participate in. Eligibility determination, these are initiated once that individual's name comes to the top of the interest list. So for Texas Home Living, enrollees are assisted by a service coordinator who's employed by a local intellectual and developmental authority, which you may know by LIDA. The LIDA will conduct all the enrollment activities, in accordance with the contracts that they have with HHSC. For class and Dbmd, enrollees are assisted by a case manager or program provider agency that is contracted with HHSC. For those case management providers, case manager or program providers conduct all the activities also in accordance with the Texas Administrative Code and contracts with HHSC. So for these waivers, there's different options available for how services are delivered. We have what we call the agency option, which is just your standard delivery that's provided through an agency. We also have a service responsibility option where the individual will manage their day-to-day activities and the provider might manage the business activities. And then we also have the consumer directed services option, which is where the individual will manage both day-to-day and activities of the services that they receive. And for those individuals, they do receive financial management services to support those activities. Not all waivers allow for services delivery through the service responsibility option or the CDS option. So I'm going to turn it over to Tracy now and let her provide information on the Mdcp waiver.
Hi, good afternoon, everyone. So I'm going to go over Mdcp. So Mdcp is one of the 1915C waivers. It provides a variety of services and supports for families caring for children and young adults who are medically dependent as an alternative to residing in a nursing facility. It's available statewide. The services are, as Erica mentioned earlier, provided through the managed care organization, through STAR Kids and STAR Health programs. Service coordination is provided by the MCO. So Mdcp eligibility. To be eligible for Mdcp services delivered in managed care, a member must be age 20 and younger. If they're under 18, they must be living with an adult family member or with a foster family. They must be a US citizen or an alien with approved status who lives in Texas. They must meet Medicaid eligibility guidelines. They must meet medical necessity determination for nursing facility care and not be enrolled in any other waiver programs.
Can I ask a quick question on that? What are the eligibilities for medical support? I know at one time there was they only needed certain things and then it changed. So what are the things that qualify them under medical necessity? Like, respirator. I think there was a few lists.
Information for you. I mean, there's a whole different assessment that's done to determine medical necessity, but we can get that information and send it to you because it's just kind of a lot there. A lot of other things there, but it's basically though to have a nursing facility level of care is what they're going to determine during that assessment.
Okay, and can you also provide the nursing homes that take children? I know I've called at least 30 of them and none of them take children under 18. So if you could provide that as well.
I don't have that offhand, but any of those questions can you send to us and we can look that information up for you and try and get it.
And we just need them to get through the presentation, Ricky, and then people can ask questions because there's so much information to go through and they're going to give you contact information of how to reach out to them because I know you have really important questions and I know you need answers. Thank you. And to everyone who's been text or in the chat box, we are recording this. You will be sent the recording and you will be sent the slide deck. If you don't get it by Friday, please email me because that means it got lost in cyberspace. Go ahead. Thank you.
Let's go over the MDCP service array. So Star Kids MDCP waiver offers the following services: adaptive aids. And all of these are available through the CDS option, except for transition assistance services. So adaptive aids are items necessary to treat, rehabilitate, prevent, or compensate for conditions resulting in disability or loss of function. Adaptive aids also may be devices enabling a person to perform the activities of daily living or control the environment in which they live. Employment assistance provides assistance to help a person find paid employment in the community. Flexible family support services are direct care services needed because of a member's disability that help a member participate in childcare, post-secondary education, employment, independent living, or support a member's move to an independent living situation. Minor home modifications are necessary physical modifications of a person's home to prevent institutionalization or support deinstitutionalization. The modifications must be necessary to ensure health, welfare, and safety, or to enable greater independence in the home. Respite Services offers temporary relief for the primary caregiver from their caregiving roles during times when they would normally provide care. Supported employment is assistance to sustain competitive employment for those who, because of a disability, require ongoing support. And transition assistance services is a one-time service to help Medicaid eligible Texans transition from the nursing home to the community. Financial management services are only available to those who choose the CDS option. And when a member selects the CDS option, I know I get this question a lot. All services do not have to be under CDS. So you can choose to select the CDS option for one or more services.
Sorry, I just remembered. So Rachel went home sick today, so she's not here with us. And so I'll cover the slides that she was going to do for class. The Community Living Assistance Support Service 1950C waiver provides home and community-based services to clients who have a diagnosis of a related condition, qualifying them for placement in ICF IID. So when we say related condition, that's a disability other than intellectual disability or mental illness, which originates before the age of 22 and is found to be closely related to ID because the condition substantially limits life activities similar to that of individuals with an ID intellectual disability and requires treatment or services similar to those required for individuals with intellectual disability, such as cerebral palsy, epilepsy, spina bifida, and head injuries. CLASS provides case management and direct services through two separate agencies. There's one that, it's specifically there for providing case management, and then there's one that's just for direct services, and they work together to make sure that the individual is receiving their services adequately. Services are available statewide and must be within the program's annual cost. And the individual may live in their own home or their family home. For class eligibility, again, you have to meet the financial eligibility for Medicaid and have to have a related condition as a primary diagnosis and have substantial functional limitations in at least 3 of the following areas: self-care, language learning, mobility, self-direction, or capacity for independent living. And like all the other waivers, you can be enrolled in another 1950C waiver at the same time. CLASS also has adaptive aids, behavioral support services, case management, but it also has specialized therapies, such as hippotherapy, which requires PTOT and National Horseback Riding Association instructor, aquatic therapy, massage therapy, recreational therapy, therapeutic horseback riding, auditory integration, enhancement training, music therapy, and nutritional services as well. But you can see that by the list, the cognitive rehab, family services, dental, community first choice with personal assistance services, and minor home modifications are also included. And then these are the other specialized services that I've mentioned already, as far as the therapies, and also like MDCP, there's supported employment, employment assistance, and transition assistance services. The other waiver that Rachel would cover would be Dbmd, the Deafblind and Multiple Disabilities waiver. And this waiver provides home and community-based services as an alternative to residing in an ICF IID to individuals of all ages who are deafblind or who have a condition that will result in deafblindness, and who have an additional disability. They also have case management and direct services provided, but this one through a single agency. Services are available statewide and must be within the program's annual cost limit. And for Dbmd, it's $114,736 for an annual cost limit. Individuals may live in their own home, their family home, or in a residence with 1 to 5 other individuals with similar needs. You also have to meet financial eligibility for Medicaid, be deafblind or function as deafblind, and have 1 other disability that results in the impairment to independent functioning and not be enrolled in another waiver. This lists the service array for Dbmd, adaptive aids, audiology services, behavioral support services, case management, chore services, PASS-HAB, that's personal assistance services through community first choice, rehabilitation, dental services, dietary services, intervenor, minor home modifications, and occupational therapy. They also have orientation and mobility, physical therapy, transportation, residential habilitation, respite services, speech, language, and hearing therapy, and also, again, like the other, supported employment, employment assistance, transition assistance services, and assisted living. And so next is HCS, and I will let Olu go over this program.
Hello, everyone. So the HCS is also one of the 1915C waiver. It provides individualized services to people of all ages who qualify for an ICF IID level of care. And the ICF is for intermediate care facilities. HCS waiver services are provided by a comprehensive program provider. Some of the services are also available through the CDS option, the Consumer Directed Services. And service coordination with the HCS waiver is provided by the local intellectual and developmental disability authority, also known as the LIDA. Services are available statewide and must be within the program annual cost limit. So the annual cost limit in HCS varies depending on the individual's level of need. I wouldn't go into details with that, but that's based on an assessment that is completed on the individual. So individuals that have a level of need 1, 5, or 8, the annual cost limit for them would be $167,468. For individuals with a level of need 6, the annual cost limit is $168,000 $615. And then if the individual has a level of need 9, it's the annual cost limit is $305,877. In the HCS program, individuals may live in their own home or family home, or they could also live in a 3-person or 4-person residence, or in a host home companion care residence, as described in the HCS rules. To be eligible for HCS, an individual must meet the financial eligibility requirements for Medicaid. They must be eligible for a level of care 8 if they are transitioning or diverting from a nursing facility, or they must be a level of care 1. And then they must not be enrolled in any other 1915C waiver. The services available through the HCS waiver are adaptive aids, audiology services, behavior support, cognitive rehabilitation therapy, day habilitation. We also have in-home day habilitation, so that's day habilitation provided in the individual's home, dental, dietary services, minor home modification. We also have pre-enrollment minor home modification. So these are modifications that are completed before an applicant is discharged from a nursing facility or an intermediate care facility, and before the effective date of the applicant's enrollment in the HCS program. We have occupational therapy, physical therapy, transition assistance services, and the services that have the asterisks right next to them are the services that can be provided through the CDS option. We have nursing services, residential assistance, and that's in the form of host home companion care. This is a 1 to 3 bed home. We have the supervised living, that would be a 3 to 4 bed residence, and also the residential support, that's a 3 to 4 bed residence. The residential support would have a staff a week, 24 hours. We also have respite, in-home respite, speech language pathology, social work services, and HCS is the only 1915C waiver that provides social work as a service array. Supported employment, employment assistance, transportation, support consultation, and financial management services. Support consultation and financial management services are only available through the CDS option to individuals who are receiving services through the CDS option. So we'd move on to Texas Home Living. It provides services and supports for individuals who also qualify for the intermediate care facility IID level of care. Texas waiver, the Texas Home Living waiver services are provided by a program provider or through the consumer directed services option. Service coordination is also provided by the leader, just like the HCSs. Services are available statewide and must be within the program annual cost limit of $17,000. And for Texas Home Living, there's no residential components, associated with it. So the individual would be living in their own home or in their family's home. In order to be eligible, the individual must meet the financial eligibility requirements for Medicaid. They must also be eligible for a level of care 8 if they are transitioning or diverting from a nursing facility or a level of care 1. They must be living in their own home or their family home and must not be enrolled in any other 1915C waiver. So all services in the Texas Home Living Waiver are available through the CDS option, and it's the community support, that's transportation essentially. We have rehabilitation, in-home rehabilitation, respite, in-home respite, supported employment, employment assistance, adaptive aids, audiology, behavior support, dental, dietary, minor home modification, nursing services, the occupational, physical, and speech therapies, and support consultation and financial management services are available again to individuals who choose to use the CDS option.
And Olu, if I could just interrupt you for 1 second, because I know sometimes that we all are so used to the abbreviations. So CDS is Consumer Directed Services. And when Erica and her colleagues were talking about your local LIDA, so for example, if you live in Harris County, it's the Harris Center for Mental Health and IDD, which was many years ago called MHMRA. If you're in Fort Bend County, your local LIDA would be Texana. If you're in the Conroe area, the Woodlands, it would be Tri-County Behavioral Health. If you're in the Galveston area, it's the Gulf Coast Center. Sorry, I don't know the LIDAs for the other areas, but that just gives you an idea when they say to reach out to your LIDA, that is what we call the local authority. So you can actually Google, who is my LIDA, LIDDA, in Texas, and then you find it by your county. Thank you. Go ahead, Olu. Or Erica.
Oh, it's fine. So I'm just going to talk about the waiver interest list. So HHSC maintains a statewide interest list of applicants who are registered or interested in seeking Class Dbmd and Mdcp waiver services. So when you apply, applicants are placed on the list and it's first come, first served basis. It's just important to note that by registering on the interest list, that's not determining eligibility. Anyone can put their name on the list and on multiple lists at the same time. The only information that's required and maintained is the contact information, but it's also helpful to give more information. But the number provided there is the number to call to be placed on the Class Dbmd or Mdcp list. For HCS and Texas Home Living, you'd have to contact the local intellectual disability authority in the county that you live, which Judy was just mentioning. And this link here provides you information on how to find the LIDA in your area. So again, we just wanted to make sure that individuals keep their information up to date with your name, your address, and your phone number. And they do send out, once you're on that list, they do send out annual letters just to confirm that you're still interested and that the information provided is up to date. There has been new legislation regarding the interest list questionnaire. So that might become a little bit more robust here in the future with what information you'll be able to have there. But for now, this is the information that needs to be provided. So for questions or resources, we have all of our waiver mailboxes, policy mailboxes listed here. And if you have any questions about any of these programs, you can email these mailboxes about your concerns. We also have policy web pages for each of these programs, and you can click on this link and they will give you, or any of the links, and they'll give you additional information about the programs as well. what resources are there, what federal statutes are there, and then also information letters and anything that's going on with that program currently. And those are the web pages for Dbmd and Mdcp as well.
And everyone will be getting this in the slide deck, not to worry.
Yes. If you get the slide deck, all that information is there. We've also included what we call a waiver comparison chart, where you can actually look at each of the waivers and see eligibility requirements, you know, how they're funded, who's authorized, just all the information that you'd want to know about that waiver next to one another to see what might be the best choice for you if you wanted to get on the waiver list, on the interest list. And again, you can be on multiple lists at one time, but this will just help give you a little bit more information of what's the differences between them just side by side. I've also included the Medicaid state plan services and supports comparison chart. So those are like your Title 19 and Title 20 programs like emergency response services. Gosh, there's so many of them. There's, you know, DOS, day activity and health services, the CAS services, you know, the personal assistance services. So there's a lot of other like state plan services that are available, and that has a comparison chart there for those as well. So that's our presentation. So I'll open it up to any questions that we might have. And again, if we can't answer your questions right now, I will make sure, you know, if you send us a list, we will research anything and get back to you that information.
Great, thank you so much, Erica, Tracy, Olu. I really appreciate it. So what I'm going to go do is go through the chat box and get to those questions. If you have to leave early, please scroll up to the very top of the chat box and complete the survey. It's how we learn, it's how we grow, and we want to make sure that this was helpful to you. So the first question is, yes, this will be recorded and the slide deck will be sent to you. Again, some of you have initials or you're using somebody else's iPad or computer, or it's a cell phone number, but you didn't register with a cell phone number. You only gave me an email. So please make sure if you don't get it by Friday, just email me and I will go ahead and share that to you. So first question, my son is on the Mdcp waiver, but I have some issues I would like to address. So should they be emailing you at the Mdcp email, or to that parent, you can unmute yourself and briefly ask the questions because we want to allow time for everyone.
And I'm okay either way. If it's specific questions about your child and the services that they're getting, you could always send us what your request is, and it will probably go to program enrollment services rather than us. We can route anything, but we don't deal directly with service provision. We are the policy. We do the policy behind the program.
I think you can answer part of my question. I
Sure.
thought if you're on Mdcp, it's supposed to help with services, not cut your services. Because my son has been cut down since on Mdcp.
What services were cut down when you say
PT, OT, also CDS hours.
So any services that are provided are supposed to be based on the assessment, and the team comes together to see what needs are there and determine what services need to be provided. It shouldn't be that they get Mdcp and services are cut, because MDC services only supplement the services that you already receive. OT, PT, all of those should be coming through your managed care organization.
I filed appeal with them. They denied it. I filed appeal and a fair hearing with the state, and I have never heard back.
You filed an appeal. Did you go to hearing and everything?
No one's responded to my appeal for a fair hearing.
I'm sorry, you said what about
No
it?
one responded to her appeal for a fair hearing. So what can she do? Because Amanda, you are bringing up something that is a very valid point. It is a
Mhm.
huge concern to so many parents. And
Yes.
Erica, I
He's
know
been
that
on MDCP for 3 years. This year has been horrible. He gets 1 day a week OT, 1 day a week PT. That's it when he's had 2.
And I'm
Like I said, I filed with the state. It took 4 hours to get someone to understand what a fair hearing is, to file it. 4 hours on 211 getting transferred because they didn't know what I was
okay.
talking.
You went through 211. Okay.
Yeah.
So have you contacted the ombudsman office?
I reached out to somebody, a name I was given. Nobody's responded to me. It's just really frustrating because you're trying to get what you
Understand.
need for your kid, and it feels like everything still, it's just like it's been worse, and I don't know what the deal is.
So I would say, and I think I've heard this before, you know, when you go through 211, the people who are in 211 are very, very, very much just generalists. You're not getting
They transferred me to other apartments. and
right. And then you probably got transferred here.
like 8 people, and then the lady had to get somebody else on the phone to help me file the appeal and stuff like that. It was just very frustrating stuff. I just didn't have a name of somebody I need to get a hold of because I filed this over 6 months ago.
I see. Yeah, I mean, right off the top of my head, I'm thinking ombudsman. Usually when you go through the ombudsman, they're the ones who's gonna like quickly put down the hammer and make sure who's ever doing what is doing what they're supposed to do.
And somebody called me and I responded back that I got the fair hearing done from that office, but they've never followed up afterwards.
So
You
Erica,
said-
who can she email for MDCP? What is that email?
I mean, if you want to send it to our policy mailbox, we can make sure it gets routed to the ombudsman office. That it's
And will you provide that in the slide deck? If so, that's fine.
yes, it's in the slide deck. the
Yeah.
MDCP
Yeah, it
mailbox.
will be in the
That
slide
policy
deck.
mailbox.
And Amanda, you bring up a really good point. And Erica, I realize that you and your team are quoting the policy, but what happens is when our families have to actually deal with the managed care organizations, they're not nonprofit organizations like Family to Family Network
And they
is.
do not have.
Right.
They are looking at their dollars and cents.
Right, right.
And Amanda, I get it. This is your loved one.
Yeah, I will fight.
And it shouldn't be about dollars and cents. So
Exactly.
Amanda,
And
thank
that's
you.
a big concern we've had with having to move into managed care.
Yes,
for
huge,
service. You know, that's-
huge.
that's-
Amanda, thank you
I
very
would
much.
like to help make a difference because it's very, very hard.
I would also encourage everyone on this call to reach out to your legislator. Explain to
Oh, I
them what is happening. You vote them in, you vote them out.
And
Yeah.
it does make a difference. I will tell you that because one
Thank
time they
you.
tried to take away his Medicaid buy-in. I called my state representative. You know, he had it back the next day. It does
you.
make a difference.
Thank you so much, Amanda.
You're welcome.
From another parent, if someone has the HCS waiver and they live in the family home and the brother who is an adult and does not live in the family home has legal guardianship of the person, can the parents be paid to provide PASS-HAB, which is paid for through CFC under Consumer Directed Services? And if they can, is it only because of COVID? Or is it only because of COVID where they think they will be back to where it's not allowed after? Does that make sense? And it's written in the chat box under
Yeah.
at 12:09 p.m. because I know that was a long question.
I'm gonna let Olu take a stab at that since she's the policy HCS, and it might be something that she needs to take back and
Okay.
specifically, but if she knows offhand, I'll let her.
And
know.
yeah, Olu, do you need to email me that answer?
Yes, I would like to respond to that.
Sure, thank
in
you.
an email. Yes,
Okay, so you're going to email me the answer?
yes, I would email you the answer.
Perfect.
But I mean, just generally, just a parent can provide CFC PASSAP to an individual who is not a minor. So if the person in question is a minor, then no,
But they're an adult.
I think they're an adult. Okay.
Yeah.
So if they're an adult and then they don't reside in the same residence, then yes, the parent can provide CFC PASSAP. But like I said again, I'd like to read through
Yeah,
the
why don't you
question again,
research it?
just
You
so
can
that
let us know.
it's fine.
Thank you
Yeah.
so much. Thank you very, very much. Very good question. Do any of the waivers pay the parent to care for their child, minor or adult child? And Olu, I think that you were trying to answer that, and then you said you'd get back to me. Is that correct? Is this kind of a similar question?
Yes, but I mean, just to put it out there, like none of the waivers, and I mean, I'll let Erica and Tracy correct me if I'm wrong, pays a parent to provide care for their minor child.
None of them do. Okay. Okay. Is that because they think the child is going to be in school, or do we know the reasoning for that?
Because the waivers are meant to supplement and not replace
Okay.
the supports.
So in answer to the question, then, do waivers pay the parent to care for their child, a minor child? The answer is no.
Correct. Part of that thinking is like, as just natural resources, a parent
Mhm.
be a provider of that child.
Right. So not until 18. Okay. Yes, someone had asked about providing links or phone numbers to sign up for those waivers. Erica posted those, and they will be in the slide deck. So you're calling two different numbers for HCS and Texas Home Living. You would be calling what we call your local authority. For those of you in the greater Houston area, Harris County, Texana, Tri-County Behavioral Health, Gulf Coast Center. If you're talking class or deafblind, multiple disabilities, that would be the 877 number that you will see in the slide deck. My child is diagnosed with autism and has been added to the class waiting list. Will she not qualify for the services if we do not meet the financial eligibility requirements? If that is the case, are there any other services available to us? So I believe I know the answer to this question, Erica, but I'm going to have you answer it, or one of your colleagues.
So our class person is not on, but I mean, I think you do have to still meet Medicaid eligibility.
Now, I've been told, Erica, that once the child reaches 18, the parent's income is no longer taken into account.
Right.
So if you have a child who is 3 years old and has been on the waiting list for 12 or 13 years, and they're now 16 years old, and their name comes up, they will be eligible for class, even if the parents are millionaires, because they have been on that waiting list for so long. That is what I have been told. Is this not the case? Or you're not sure?
I don't know that it's based on them being on the waiting list. I mean, still do this, everybody still gets enrollment.
Right.
Determination, financial determination, but I can check to make sure.
Yeah, if you could, that would be great. And because I think that's really important for people. And a perfect example of that is, I know someone whose name did come up, but then they ended up moving away, so it didn't matter. So, because then they had to follow the laws of that state.
Right.
But if
you are right, at their age, once they become an adult.
Right. But if you could let us know, that would be great.
Sure.
For those parents where their child's name comes up, but they're under 18. That would be really helpful. And this is for any of the waivers. Someone asked, is that through HCS? And this would be for any of the waivers. What are the dollar figures? They are saying like 168,000. Is that what the waiver will supply? It was something that you mentioned, Olu, on slide 27 or 28. And Callie, I think I know what Olu means, but she can answer that. Olu, do you know what she's referring to?
Yes, that's the limit, the annual cost limit for services that the waiver would cover for an individual.
Okay. And is that for a specific waiver or for any waiver?
So I was speaking specifically about HCS.
Okay.
And like I mentioned during that presentation, it actually varies
Mhm.
depending on the level of need of the individual in question.
Okay. So
And each of the waivers have different limits and.
got it.
And
And that was for HCS. Okay.
right, she was talking
So
about-
to answer that parent's questions, the $168,000 is the HCS limit of what the waiver will supply. So that isn't designated by the managed care organization. That is the law. That's the policy.
I also wanted to have that again, the annual limit varies even within HCS,
Okay.
depending on the level of need of the
Okay.
individual in question. So that was just one of the limits that
Oh, I see.
the 160.
And was the 168,000, do you know what level of need that was for? And that's okay if you don't. That just gives people an idea. And to those of you on this call who may think, oh my gosh, $168,000, that's so much money. We have families who need 24-hour care. And it is labor intensive. It is emotionally intensive. It is exhausting because their children could be, or adults, I call them kids, but the adult could be on having a feeding tube, a ventilator. They need 24-hour nursing care. I hope that answered that question, and you can always email them. Can you provide the average wait time for waivers? I always tell families 12 to 15 years. Does that sound fairly reasonable? Erica, Tracy, Olu?
I mean, it can vary, and COVID hasn't helped with being
No,
early.
it has not.
But
And
we do have a website. You can actually look up the numbers for each of those.
Mhm.
And let me see if I can find it, and I'll put it in chat for you guys.
That'll be great. Now for MDCP, your wait time might be a little less. But for the other waivers, HCS, class, Texas home living, 12 to 15 years. It is very, very sad. Again, please contact your legislators. My understanding is that income eligibility is based on the client's income, not parents or caregivers. Is this correct? Yeah, we touched a little bit on that earlier. The question becomes if the child's name comes up before they turn 18, and Erica will get back to us on that.
Right.
So I'm
and
so
I think
sorry.
for MDCP, it is based on the child's income and not the adults, but not like AES, which is access and eligibility. They do determinations and all that for, so, that's not exactly our area.
Sure.
We do more of the provider.
We can find out. Absolutely.
Yes.
Thank you, Erica. When is the legislative or probably legislators looking to change as it is in review right now, correct? That's a great question, Ricky. I think that you need to reach out to them, reach out to their staff. And please know that when you call the legislator, if you do reach one of their staff members, they can be really helpful and instrumental in relaying your concerns, your questions to the actual representative. So reach out to your legislator. I'm not sure that it's in review right now. I don't know. I honestly don't know the answer to that question because there's so much in review. And I think we're on what, the third special session or fourth special session. So I'm sorry, I don't know the answer to that question. Great suggestion, Jordan. Just a suggestion from a fellow parent. Even if you don't qualify now, add your child to the list. And that's exactly right. You don't know what your status will be when your child rises to the top. My son was on the late wait list for 7 years, and that's exactly correct. You don't know what the future holds. None of us do. I believe in success for everyone, regardless of disabilities. And success means different things to different people. But if you think that your child has a disability, or if they've been diagnosed with something and you think they don't qualify, please put their name on the interest list, because these diagnoses can change over time. We have learned that. They think your child has ADHD and it turns out they have autism, or it turns out that they have an intellectual disability. As they get older, sometimes the gap widens. The Katie Beckett, and I think you did spell it correctly. Go, Aubrey. The Katie Beckett waiver qualifies someone based on the child's income and not the parents. Not sure if it's class HCS. Erica, I'm not sure if you know the answer to that question. We might have to Google that one. Are you
That's the
familiar
one
with
that's in another state that's similar to, it's similar to MDCP services.
Okay. Okay, thank you. So I'm not, sorry, we don't have an actual answer for that on that, Aubrey. Christy, when you said the kiddo can't be on another waiver at the same time, can we drop one program when we come up on another, or will we be disqualified if we're already on one? Great question.
No, you can transition. You can transition to a different services. If you, they basically will just coordinate with the service coordination to make sure that the other waiver, if you get off the list, you come up to the top of the list and they find you eligible for that waiver, they just make sure your start date, the end date of the other one is the day before the start date of the other waiver, so that you're not on at the same time.
Okay, so one will end and the other will begin.
Exactly. Yes.
Got it. Okay, thank you. Took 6 years to get MDCP, still waiting for others. Thank you, Amanda. And I will be going through all of these. I know we have several people asking questions. I'll be going through all of these as long as you all can stay on. I have a 5-year-old with autism. What programs would you recommend signing him up for? I would definitely do HCS, class, Texas Home Living. You're muted, Erica. No worries.
I would also suggest looking at the comparison chart. I mean, a lot of this has to do with the functionality rather than just the diagnosis. So looking at what type of, functional limitations the child might have can help sort of dictate which program might be best suited for him.
But I would definitely sign them up on those 3 because he's 5 years old and we really don't know how he's going to grow. Yeah, but definitely those 3. I have a question and would like to ask verbally. Let me do this, Jordan. Let me get through these other questions if I could, and then I'm going to get to you. Okay, I promise.
One more comment on that one last question. The yes waiver is not one we went over. It's another 1915C waiver, but I tend to see a lot of kids with autism utilizing yes because of the behavioral issues that tend to come up. And the yes waiver does sort of like counseling and things like that through MHMR. And so that would be something I would suggest too.
Yes, and that's a great program. It stands for Youth Empowerment Services. So what I would do is contact, again, the local authority, call up the main number and say, I would like to speak to the Yes Waiver Program Coordinator. Is there still a Rider 28 program with MDCP, and what does it entail?
I'm thinking they're talking about the money follows the person. So that's basically a program that, an initiative that was enacted to help persons who are in institutions or nursing homes transition into the community. And so with the money follows the person, they may be able to do, to get transitioned out. It almost kind of bypasses the interest list. There's ways to, they have to have a 30-day stay in the nursing home, and
that was actually my question back to the nursing homes. There is not one nursing home in a 900-mile radius that will take a child so that they can stay in the nursing home to then get taken out of the nursing home to qualify for that program. You have to be 18 or older.
I see. Yeah,
so Ricky, I would definitely email them that and try to keep finding out more. Jordan, did you want to unmute yourself and ask your question briefly, please? This was for Jordan Davis, if you're still on.
Yes. Okay. It's really, I mean, I don't expect you to have an answer for me, but maybe you can point me in the right direction. It's back to the parents caring for their children. Like with my son, I had to quit a $35 an hour paying job because I go to doctors and therapists and he's in the hospital so much. So all I can get that will allow me flexibility is, something minimum wage that isn't going to cover the bills. So the other option they gave me was, well, we can provide a nurse for him. So if you're going to pay a nurse $30 to $35 an hour, why can't you pay the parents a reasonable wage to care for their child? And
They're probably not paying a nurse $35 an hour though, are they?
Well, my nurse, that's what my nurse told me she made.
Oh, wow.
But that's even then, if they could pay the parents a $10 or $15 an hour wage,
Mhm.
then we're supporting our children. We're able to be there for our children because we can't support ourselves. It's just not
Yeah.
possible. I
You're
do
right.
an overnight paper run running the Chronicle. So now I have to care for my child half asleep because I only get 3 hours of sleep every night.
Oh my gosh.
I just don't know if there was, like, maybe you could point me in the right direction of somebody that could work with us as parents and get some legislation written so that maybe, and not every parent, because a parent whose child is ADHD doesn't necessarily need that care,
Mhm.
or doesn't, but someone whose child needs nursing care, maybe that would be
Absolutely.
a qualifying, thing. If you need nursing care, then we'll pay the parent to care for their
Sure.
child.
Erica, thoughts? Where should she go?
Yeah, I mean, it really goes back to the legislation. It really goes back to contacting your legislators and letting them know, that you're not getting what you need. You can get nursing services through your MCO, if you're MDCP, or not even through MDCP, because nursing is not one of their services, but a kid who would qualify for Medicaid could get the Star Kids plan and get.
See, that's what threw us into a loop, was because financially he doesn't qualify for Medicaid, but he's on MDCP. So
right. Okay. So that's how you're able to get the nursing services.
Yeah. So it just, and I just wondered if any of even the parents have a person that's friendly to our cause and could, point me at them, because contacting a random legislator who doesn't care anything about this community is not helpful.
Well, but contacting your own legislator, because you're one of his constituents, does make a difference.
Okay.
That I can promise you. Every time I have reached out to my legislator, I always get a response because I can vote them in and I can vote them out.
Okay.
Yeah, I would definitely do that. I realize you are going through a terrible time, and you're right. The system is very, there's a lot of issues, Thank you.
Disability advocate rights, like disability advocate groups that you could contact as well.
Mhm.
Also help push legislation and get things, so.
They do. There's a great one called Protect Texas Fragile Kids. If you're not familiar with them, I believe they're on Facebook or Google it, but there's all sorts of legislation. Protect Texas Fragile Kids.
Okay.
Is there an advocate we can sit down with and talk through this maze? Because it is a maze, and as you know, it's a lot of information. How would somebody go about doing that to help guide them? What is the best waiver for them, Erica?
Are you talking about reaching out to the disability advocates, or figuring out waiver?
To understand, and for the person who wrote this question, they just said, is there an advocate we can sit down with and talk through this maze? I don't know if their child's name came up.
So your service coordinator is supposed to be that person for you to help.
Keywords, yeah, supposed to be.
And know what resources are available. And if you're asking these questions and they don't know the answer, they should be looking for the answer. But they are the people who are supposed to be finding the resources, not just in the medical, but in the community that might be available to, when you're doing service planning and figuring out what your needs are, figuring out what resources are available in the community, what resources, the medical providers will be giving, and that's supposed to be their role.
And if I could make a suggestion, if you think you're being misinformed, if you're questioning it, I suggest you email the team that is on this call and ask them, what is the law?
Yes, and again, if anyone is on this waiver, or if you're not, but you're interested and you want to know more information, we can definitely get you information about it. We can get you policy, we can get you rule, help you get to where you need to go for what you need.
What qualifies for nursing instead of caregiving hours?
I'm not exactly sure I understand.
Yeah,
Whichever program you're in, or if it's in managed care, the assessment that they do whenever they're determining the services is going to determine the nursing that you get, or the number of hours. It's going to be determined on the assessment that they do for your child. Or
So what if you don't agree with the assessment? Like, I'm just going to throw mine out there. My son has seizures every day. My son
Right.
has 10 seizures.
you believe he needs more services than what they're offering.
Yeah, and all I can get is a college student to come help me with my child, because he has. They said, "Oh, we can
Nope.
send a nurse."
I understand.
My son doesn't have seizures at the same time every day.
Of course not.
Right.
Of course not.
Intractable epilepsy. It's not controlled by meds. It's not
Right.
controlled by BNS. I need help. And
Erica,
so basically, he
she-
doesn't have a G tube, so because he eats
Right.
by mouth, he can't get nursing. That's not fair.
you're right. You're right. Erica, this is where she goes to the fair hearing.
Fair hearings, yeah. I mean, we're supposed to
I
have
can't even get them
the
to
place like fair
respond,
hearings
so-
if you disagree with the service plan, so that that can be re-examined. I know for the MCOs, and this is sort of a new process, but they're putting in place sort of like a second, someone to look at those services, someone else to come in, a different outside of their organization to come in and see, did they follow what they're supposed to? Are they giving these people the services that they're supposed to do, to better sort of regulate sort of the
So with that, so I have United Star Kids for MDCP. My service coordinator, I had to explain what a service coordinator's job is. You coordinate a service, but you cannot help me get services. They don't do all that. Like y'all explained, they should help you. They don't.
Amanda, I know you have a huge problem. I have someone who might be able to help you. If you could please email me. You have my email address, Judy@Family2Family Network. Remind me, and I'm going to see if I can put you in touch with someone. Okay?
I'm not trying to complain. I just want y'all to know that there's.
No,
things
you're right.
I want to
You are-
fix it. I want to do what I can to help other kids.
I understand. Please email me, and I'm going to try to put you in touch with someone. Okay?
Awesome. Thank you so
I
much.
promise. After 12 years on waiting lists, my son finally received DAD, which no longer exists. After 3 years, he no longer qualified for services because he didn't require nursing services. He never required nursing services. How do we know when rules change? Is there a website we should always be looking at every 6 months or so? You were on mute now. Sorry, Erica.
Am I okay?
Yeah, now we can hear you.
So when you say rules, so was this through a waiver? Is this managed care rule? I mean, not sure what.
I'm not sure.
My question.
Oh, okay.
Anytime that we do have a change in the rule books or the handbooks, like there's a .gov notice that goes out. So, you could
You can
always
sign up for those.
and
Okay.
be alerted
Yeah.
to what changes have been made.
You
Okay,
can go to
well,
the
he was-
HHSC
He was
website.
18 when we signed up for all of the waiting list. He was, it took 12 years, so he was 30 when he finally got, and they said it was DADS, was the only one that he qualified for. He has Down syndrome and autism. He does not need medical care, but he needs the main thing I wanted was somebody to take care of him for a little bit. I did find out that that was the program that I needed. I went to work for a company that y'all paid, and they paid me. Now they kept most of it, but anyway, so there are places, but you have to work through a company. I couldn't be the company myself because I'm his guardian, and I would have to give that up if I wanted to be in control of that.
Do you know if it was called SIMPAS? I'm thinking because DATS is what HHSC is. DATS used to be, it's just Department of Aging and Disability. That's just what the agency name, what it used to be prior to the, because we don't
That's
have
an old name.
I know it's old, but you know, I'm old. So
I don't think that's the program per se. I think that's just the agency, you know. So it may have been PASS or FC, one of the other programs.
I think you might need to email them because I want to get through these and it's already 1:15. Stacy, I am so sorry. I'm very
he's not qualified now, supposedly, and I turned down the class because he was on that, and so I guess we're starting over.
I would email Erica before you do that.
Okay.
I really would. Before you do anything, I would at least email her or somebody on her team before you take your son off the list, because we know how long that list is.
Yes.
And I get it.
Okay. Thank you.
How do I find out if my son is already on the interest list? Call the phone numbers and they will tell you. So what you can do is call your local authority to find out, and also call that 877 number that you will be getting in the slide deck. Can you still put your name on the wait list if you still don't have a formal diagnosis because the new condition, the condition is new to the specialists and research is being done? Absolutely. When in doubt, put your name on the list. TEA has an autism supplement for individual education plans. Yes, they do, and it is a good one. Put the parent request in writing to the school for a full and individual evaluation for service there too. Is there a certain cognitive requirement for HCS and Texas Home Living? I would refer to the chart that Erica has put on there. For HCS and Texas Home Living. Is that okay, Erica?
Yeah, that's okay. Yeah, it's in there. It's included in there.
No question is dumb to the person who wrote this. How do we reach out to the legislator and what do we say? So what you can do, and no question is dumb, you can Google who is my state representative in Texas, and it will bring up a website, and you put in your zip code. Now some of the zip codes are kind of weird because there's so much fluidity right now, but it will tell you who your representative is by zip code. And a lot of people, this person wrote, it's very challenging. You may not be low income, you certainly aren't high income, you're that middle class, and the middle class has a very challenging time sometimes getting services. For those of you who are not familiar with Community First Choice, this is a program that parents might be able to access if their child is on Medicaid while their name is on the waiting list, that interest list. Community First Choice. You can contact them through the at your local authority, the Harris Center, Texana, Tri-County. I'm sorry, I'm going through these quickly. Our son had a major surgery for a congenital heart defect. There was nothing to help us to care for our child for ourselves. I had to care for him or her 24 hours. And then years later, he qualified for PCS because he had both legs worked on, and they had nobody in their PCS, all because we live in a rural area. Huge problem in rural areas, correct, Erica?
Yes.
Contact your legislator, but yes, huge problem. I don't know the answer to that. Do you?
No, I mean, you know, if there's not anyone, I think part of it might be pay. You know, if we improve the pay for personal care, you know, people, then we might have a higher workload to choose from, or people to.
Yes.
But now it's and that's not just there. I mean, that's across the nation. That's hardest positions to keep and have people there for. So And it makes it even harder when you are in a rural area.
It does. Contact your legislator. Protect Texas Fragile Kids is one, and yes, parent to parent is another one. Please make sure you complete the waiver. Disability Texas and Texas Parent to Parent and your state lawmaker. So if you think that your rights of your loved one are being violated, yes, you can contact Disability Rights Texas, and they do not charge. They are a nonprofit like we are, and you can go on their intake form on their website, and they will tell you if they can take your case. Service coordinators are brand new to the system. There is such a high turnover rate. You are right, that is true. What about applying for TANF due to inability to work, secondary to having to care for your child with a disability? Yes, you can try to do that. That would be through, I think it's yourtexasbenefits.com. So yes, you can definitely try to do that. I have a son with cerebral palsy, global development delay. We just moved to Texas. I'm trying to find out where I can start out to care for him. So what I would do, Lucy, is go to the Family to Family Network website, and under resources, we have just moved to Texas or moving to Texas, and it tells you everything you need to do. Another great website is Navigate Life Texas, and that's all spelled out. Navigate Life Texas. Really, really great website. Another question. Caregiver is a provider, attendant, and there to help with activities of daily living, toileting, feeding, bathing, transfers. A nurse is medical, medication, administration, checking oxygen levels, trach care. Would you agree with that?
I mean, for the most part, I know, and there sometimes, like with MDCP, where you get respite, it might be provided by, and I know managed care will try and use respite hours for like 19 hours, but again, it's really supposed to be to give relief to the caregiver, you know, when the caregiver will be giving services. But yeah, generally speaking, an attendant will do, you know, and it depends on what service is being provided.
Yes. And our families are hurting. I completely understand families. I'm the single parent of a son with a disability. I completely understand. Easter Seals is another great organization. Legal representation, you know, it's definitely personal choice. So I think I got everyone. I'm hoping that I did. If I didn't, please put it in the chat box, but I think I got everyone. At least I'm hoping that I did, because I'm not able to scroll down any more than I already did. If you would like to put something in the chat box real quick, I will stay on, and the presenters will as well. You're very welcome. Got a couple of thank yous in there. Thank you. We never claim to have all the answers. Myself, Family to Family Network, Erica and her team, but we are truly trying to get you some answers. Email them. They are going to be emailing me answers. And by all means, as I get those answers, I'm probably going to wait a day or two for Erica to work on those. And by Friday, it is my hope that I can send an email with the recording, the slide deck, and the questions that were asked that Erica and her team were going to get back to us on. Another thank you. Thank you so much. Our pleasure. Could you please put my email again? Sure, I'll put it in the chat box. I'll put it in the chat box right now. And I'm also going to put some really great websites as well.
MEPD would be another website for someone who's new moving to Texas, looking at what programs are available. That's Medicaid for people with disabilities. They do the determinations, eligibilities for like some of these waiver programs, but also could point you into the direction of what services might be available for your kids.
Sure. Okay, Navigate Life Texas. I put my email in there. You are very, very welcome. We are very happy to help. I wish that everyone had every answer imaginable. It's just there's so much. Our systems are so complex, and it makes it very, very challenging for families.
Yeah.
I never claim to know the journey that all of you are going through. I can only tell you, I know that it is not easy. I completely understand it is challenging. I am going to stop recording at this time. Thank you all so much for joining us. And Erica and your team, if you could stay on for just a moment, I really appreciate it. Thank you all so much.